Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. Oh man, all right, how you guys doing this week? Today I'm going to have Mr. Bones help me to describe and talk about hip pain and hip discomfort. So there's a lot of misconception with the hip in simply that people will come in and I'm going to use Mr. Bones as my model here, and he's facing you guys and looking at it. People will come in and they'll touch the front of their hip here and they'll say, man, I'm having a lot of hip pain. Their hand will actually be on their hip. Other people will come in and their hand will be on their back and back behind them this way, and they'll say, man, I'm having a lot of hip pain. So they'll come in here, or they'll have their hand here, or they'll have their hand on their side, and they'll have different points of pain, but people will refer to it as hip pain. So in looking at the hip, and this week's handout ties in with this, you may have the ball and socket joint here called the acetabulum and the femur head where they come together. That's the ball and socket joint where the hip moves really nice. And the other part that you can think of with the hip could actually be at the pubic bone or pubic symphysis here in the middle where the two iliums come together. Another area that can be described as hip pain is the sacroiliac joint. So here we have this triangular bone here, and then we have the ilium here. So where they come together is called the sacroiliac joint. And I don't want to get into a lot of detail, but just to give you a feel for, people could say, hey, I've got hip pain, I've got hip pain, or I've got hip pain, and they could be touching, what people would consider completely different areas, but they all describe it as hip pain. And so the key thing here when doing an examination or an investigation of what the heck's going on, is it low back pain, meaning the facet joints here in the vertebral spine could be causing radiating pain down into the hip. And I've looked up some cool photos and things I might include in with this video, little pictures, or I might post them later and use on Facebook and Instagram and stuff, because they've got some great pictures out there to help people understand what hip pain truly is. So looking at the pelvis as a whole unit and then breaking it down into bits and pieces. We're going to test the piriformis muscle. We're going to test the gluteus maximus, gluteus medius, gluteus minimus. We're going to check all the hamstrings and make sure all three of the hamstrings are working on both sides, because that can definitely affect hip pain with the anterior pelvic tilt. So there's a lot of issues that you got to look at when it comes to saying, oh, I've got some pain in my hip. There's osteopenia or osteoporosis, osteoarthritis. There's so many different diagnoses that could be brought up with hip pain. So keep an eye out this week. Look for little posts and stuff I'm going to be doing looking at hip pain. If you know someone who's suffering with hip pain, I also found some cool pictures of hip replacements where they show that rod in there that used to be bone and now they've replaced that. And I mean, sometimes it's necessary. If I can't get someone's hip doing better in a decent amount of time, looking at the x-rays, looking at the MRIs, sometimes when people get their hip replaced, they do function better. They get their quality of life back. So I'm not one of those people that say, oh, you shouldn't have hip replacement. Hey, some people need it. Some people have had such trauma, and then over the years, the joint is just degenerated to a point of, man, you should just get that thing replaced. So we work together with different surgeons, especially here in Arizona. We've got so many amazing places to care for people. And part of that is because we have an older population where their joints are deteriorating faster, and they need to have more work done. So think of being preemptive. Think of looking at things before we would need to be talking about hip replacements and things like that. So I hope you enjoyed this week's video. Please feel free to comment on Facebook and different things and let me know what kind of videos you're looking for. And we hope that you have a fantastic week. All right, take care.